You are in the right place if you're looking for answers to Medicare and all of the changes that are coming. So there is a lot of change, both from the expense perspective, both from the options perspective. Good news is we have Dave Adams with us today. Dave is somebody that Trinity really trusts and respects from the perspective of being the answer man in a very confusing world. This is a full-time business for us. Dave, go ahead and start with a little bit of your background,
Sure.
how you got into this, how long you've been into this business, and I'll open it up then to some of the big questions that people face, all the changes. We'll be sure and cover that today, and how you can make the right decisions, which it's very confusing, are very individualistic.
Yeah, no, first of all, I want to thank you, Jim and Trinity, for allowing us the opportunity to bring this webinar to people today. This is a very timely webinar with Medicare's open enrollment period starting next month. Yeah, just a little bit of background on myself. My name is David Adams. I've been in the Medicare space as an independent agent for 10 years now, meaning this will be my 10th open enrollment period. Ironically, I got started in this as a financial advisor myself, and then quickly realized that I want to just focus solely on Medicare. So I've been doing Medicare as my standalone business for 8 years now. And that's all I
And
do is
one of the
Medicare.
reasons that we like working with you, Dave, so much is you understand our space
Right.
and how those two spaces intersect. Having been a financial advisor, how do you make those right decisions for you? Talk a little bit or expand a little bit on what it means being an independent as opposed to working for a particular company.
Yeah, no, that's a great point. And being independent means that I am contracted and represent multiple insurance companies and carriers, meaning I'm not working for one specific company. So that gives, when we're talking to your clients or we're talking to helping people out, we have a broad range of carriers to work with and to consider. And it just works in the best interest of the people we're out there helping, right? We're not going to force feed you into one particular plan because that's the only company we work for. And I've worked with multiple companies, and quite honestly, there's a few out there that we just choose not to work with because of customer experience or agent experience. But yeah, so typically we're independent, meaning we're going to work in the best interest of the people that we're there to help.
I know what we found, Dave, that is, I don't know if it's too deep for people, but there is typically you're going to go the route of using a supplemental plan or
Mhm.
advantage plan. And what we were very pleased, that tends to come with an advisor, even the independents that tend to be a little biased towards the kind of people that they represent. Our clients kind of covering the broad spectrum. We wanted somebody that knew both ends of the perspective, and were very impressed with the fact that you represent both of those. Can you briefly explain that difference between the supplemental versus the advantage plans?
Yeah, and I think just to reiterate on that point, I think if you truly are an agent and doing what's in the best interest of the people you're out there to help, you should be representing both a supplemental and an advantage plan. But more importantly, you should be educating people on how Medicare works, what it covers and what it doesn't cover, and then based on their specific needs, what type of supplement plan will work and what type of advantage plan will work. And that's primarily how I work is I'll show you one or two supplements or one or two advantage plans. But to answer your question, the difference between the two, so let's go all the way back to original Medicare. I'm going to go very high level. I don't want to get too into the weeds because I don't want to
Thank
confuse
you.
people. I don't want to confuse people any more than they already may be. So at a very high level, original Medicare has two parts. So part A is your hospital insurance, and then part B is your doctor insurance, your health insurance, really. And that's offered by the federal government, and that typically covers about 80% of your cost. So the government, original Medicare will cover 80%. You would be responsible for that other 20%. And what's important to know about that is that 20% is unlimited. meaning there's no cap, there's no max out of pocket. It's just 20% of whatever those costs are going to be. And that 20% is where we help people out the most. Okay, so original Medicare, Part A hospital, Part B doctor, 80/20, that's original Medicare. So what are your options to cover that 20% and some of the other costs? So option one is called a Medicare Supplement Plan. Okay, and these are offered by insurance companies. And basically the way a supplement plan works is you would pay an additional premium to be on this supplement plan. And for that premium, you could go see any doctor anywhere, meaning there's no networks, no referrals, and no copays. So as long as the doctor or hospital or specialist takes Medicare, which most of them do, you could go see that doctor or that hospital or that specialist. And what that covers, what the supplement covers, it supplements original Medicare. So there's a couple of deductibles that it covers. It certainly covers that 20% co-insurance because that's your biggest risk, right? As a member as somebody who's on Medicare.
Yep.
And so that's the supplemental. And then with that, you'd want to add a prescription drug plan because original Medicare does not cover prescription drugs. And those, again, are offered by private insurance companies. You may or may not have a premium, and then you'd have copays as you get your prescriptions refilled. So I like to tell people, think of the supplement option as like a puzzle with different pieces. So Part A and Part B of original Medicare are puzzle pieces. The supplement itself is a puzzle piece, and then the prescription plan. So they all kind of fit and work together.
Yeah, but that's so confusing. Talk a little bit about the Advantage then.
Yeah. So the other option of that works with original Medicare is called a Medicare Advantage plan. And think of this as a package. So what I mean by that is this is going to combine Part A hospital and Part B doctor are part of the package. The prescription coverage is going to be built in and be part of the package. And then the Advantage plans offer additional benefits like dental, vision, fitness, some over-the-counter benefits, that type of thing. But the way an Advantage plan works, typically the way they work is these are network plans, meaning your doctor, specialist, hospital would all have to participate and be in that plan's network. Depending on where you live, Jim and I live right here in the St. Louis area. Most of the Advantage plans here have a $0 premium. Some of them do charge a little premium. They're not nearly going to be as much of a premium as you were if you would have a supplemental plan. But the point is they're low cost $0 premium plans. However, you will have copays. And those copays are as you go, as you see your doctor, there's a copay. If they got to run a test or an x-ray or any type of procedure, there's copays for that. Again, if you go into the hospital, because this covers Part A, there's copays for so many days in the hospital. And then these Advantage plans will cap those copays with what's called the maximum out of pocket. So if in a calendar year, your copays hit that maximum out of pocket, then any cost beyond that would be picked up and covered by the insurance company. So a real easy way to kind of remember or differentiate the two. Supplemental plan is basically you pay every month, whether you use it or not, kind of like car insurance or homeowners insurance, right? You're paying those premiums every month. An Advantage plan, you basically pay as you go up to that maximum dollar amount type of thing. And there's plans, I mean, that when you get to Medicare, it's very individual, right? When you're working for a company and you're on a group plan and you have your family on that plan, it's everybody's on one type of plan. When you get to Medicare, it's very individual and everybody's situation is different. Meaning your doctors, your medications are different than maybe your spouse's, maybe your brother, maybe your cousin, because you're going to hear not only will you get inundated from the carriers and the marketing, the people that are already on Medicare are going to be telling you what they have and why they think that's the best. And it may or may not be the best for them, or it probably is the best for them, but it may or may not be the best for you. And that's why it's important to honestly work with a Medicare agent, a licensed Medicare agent that's going to take the time to get to know you, your needs, and your concerns and your overall situation and then, like I said, educate you on how it all works, and then give you the option of choosing between a supplement or an advantage plan. And selfishly, that's what I like about what I do. I don't feel like I'm selling anybody anything. I'm educating them on how it all works, showing them one or two options based on their specific needs, and then ultimately they decide which plan they want to go with. I know it's kind of a long-winded answer, but
No, that's a great answer, kind of a great overall summary. And if you're just joining us, I see the numbers are kind of piling on now. So thank you. You're in the right place with Jim Matush and Trinity Wealth Advisors as we talk this month with Dave Adams from Simply Senior Solutions. And Dave is a expert in this area, someone that we have a lot of confidence in because he makes this stuff understandable, comes at it from an educational perspective, has a very relational. So we're talking about, if you've just tuned in, the time in your life where you go from a group plan, usually with a company, to, now I've got to understand that, and each of us are unique. We've each got different health challenges or benefits or situations. And going through the maze of everything that hits you in the mail and determining which is best for me, if you could trust someone, what you will love about Dave is, and at the end we're going to give our numbers and how to reach out. The main reason that we like Dave is he knows this. There is no bias to one program versus another, whether supplement is better for you or the advantage plan. It's strictly a cost versus benefit that he's able, I know, has worked with my family in helping determine what's best for you. In fact, and it changes each year. That's another thing that Dave let us switch to in this point of the conversation, the massive changes that have taken place. I know we were talking about big picture, not to get political here at all, but how things have changed through the two different administrations, where you had, the first Trump period where things kind of massively deregulated. Then they started regulating, and now going back through deregulation with Trump getting back into office. So, not again political, but how has that changed what our options are and the things that shape the decisions that we'll make? Again, 2026 being a very different year. And that's why I think we're getting so many people turning in, because I guess the word is out that everything's going to be a lot different next year. Could you cover those things from a high level, Dave?
yeah. So, as far as changes for next year with regards to Medicare, what's happening is you're seeing a lot of, so Medicare, those advantage plans, let's talk about those for just a second. Those advantage plans are basically, for lack of a better term, subsidized by the federal government. The government says for everybody that you can enroll in your advantage plan, we'll give you X amount of money, right? And those advantage plans for the last 5 to 7 years, those insurance companies have been all about grow. Let's grow, grow, grow. Get as many people signed up as we possibly can. Okay. Well, now a couple of things are changing within that space, kind of behind the scenes, but the federal government is not going to fund those subsidies to the degree that they had been in the past. So they're pulling back some money. And you're seeing these big insurance companies now are going to switch and focus on let's be profitable as opposed to let's grow. So what does that mean to you who may be on one of these advantage plans or even the supplemental plans for that, for lack of a better purpose? They're all focusing on profitability. You're seeing reduced benefits. So some benefits that may have been built into those advantage plans, they're clawing some of those back or reducing some of those benefits or eliminating some of them altogether. You're seeing increased cost to the member, to you, the member, in terms of higher premiums, higher copays, higher deductibles, that maximum out of pocket, those numbers have been going up as well. So a lot of this cost is shifting from the insurance companies back onto the consumers. And specifically with regards to prescription drugs, anybody that's been on Medicare prior to last year knows there's been some major changes to the prescription drug plans. And it's always that unintended consequence, right? At the very high level, the plans or the ideas that are coming out of Washington sound good, but ultimately it's going to be more expensive to the people that are actually trying to use these plans. So for example, they took away the donut hole with regards to prescription drugs, and I'm not going to get into that because it was confusing to me as an agent, but it was a higher threshold that people would have to pay over the course of a calendar year. And they've reduced that down, which is good for the consumer in theory. However, those costs have shifted back to the carriers, and those carriers, now that they're focusing on profit, are going to shift those costs back to you, the consumer. Again, higher premiums, higher copays, reduced benefits. So that's the biggest challenge that's facing people right now. And if you're on a plan and you don't do a review, you get in the next year, these plans just automatically renew if you don't make any changes, which is fine. But let's say you're in a plan that where some of these benefits have been taken away or reduced, you get in the next year and you go to use the benefit and they're like, oh, sorry, that's not covered anymore. Or we don't have that specific benefit. At that point, it's almost too late. You're kind of stuck with that plan for the remainder of that year. And another thing we're seeing a lot of is these insurance companies are actually reducing plans, not just benefits, but some plans themselves. They may I'm just making up some numbers, but say they had 10 plans in Missouri, they may be narrowing it down to 2 or 3 plans. So if you're on one of those plans that's being eliminated and you don't know about it, you'll know, they'll tell you, they have to tell you. But if you don't pay attention, you could be in trouble getting it going in the next year and realizing that you're not even covered, or you now need to scramble and find a plan that's going to work best for you next year, type of thing. So a lot of disruption in the business of Medicare, these insurance companies, and ultimately it's affecting the people that are using the plans and the coverage themselves.
I know it is very confusing to those of us on the end result page where we're getting all of these calls, we're getting all this mail, and we're confused more and more. And basically, those that are reaching out to us are trying to get us in that picture of increasing their numbers versus someone like you that's independent is trying to help you figure out what is the best option for you. And it doesn't really matter to you which way
Right.
they go, correct, Dave?
Correct. Correct. Yeah. Yeah. As far as
That's what we love. And once we're in your database as a client, just like at Trinity Wealth Advisors, people come to see us regularly as life changes, as the Medicare environment changes. Talk about how important it is to stay current with changes like 2026 and what's going on. And I know that's right around the door, and you can't talk about it specifically until October 1st. You already know some of these things that are coming, but I'm here. I got a question just popped up. How do you get paid, Dave? So I'm saying that it doesn't matter to you. Talk up briefly about that and how that bias comes in with the people that are reaching out to us versus someone like you that's independent.
Yeah, no, and that's a great question. And honestly, I love to answer it because, first of all, Medicare is a federal government program, so it's very highly regulated. Okay. And the way I get paid is I get a commission from the insurance company for whatever plan you decide to enroll in, whether that's a supplemental plan or an advantage plan. And for the most part, those commissions are also highly regulated, meaning certainly on the Advantage plan, every commission is the exact same no matter which carrier you go with. Okay. The supplemental is a little bit different. Actually, to be fully transparent, the supplemental, the commission is less than it would be for an Advantage plan. However, I like to think that because it's all regulated and it's all about the same you've heard of lifetime value of a client. The lifetime value of a client in my business is about the same no matter which type of plan you choose. The fact that it's regulated and it's basically the same just means that when you work with an independent agent like myself, we are truly working in your best interest, right? We're not going to push a plan where we might make a little bit more money here, a little bit more money there. We are truly going to get to know you, your needs, your concerns, and tailor our recommendations to fit the plan that you deserve, as opposed to a plan that where we might make a little bit more money here or there. That's just simply not the case. And it doesn't cost you anything to work with an agent like myself. We can't charge a fee. Again, that's part of the regulation. So we don't charge a fee, and it doesn't cost you anything more to work with me than it would be if you were to sit down and try to figure all this out on your own. It's just like going to gym. You could certainly manage your investments and financial planning possibly on your own, but why not go to an expert who's in this and does this every day and focuses on your specific needs with regards to your financial plan? So that's so yeah. The
That's
commissions
why
are
we've developed trust in you, Dave, as we know you. We're very comfortable with how you've made us feel. I know you've worked with the different players, partners at Trinity, and it's kind of like the comfort of going through this maze. Now, let me shift to some of the things specifically in 2026, again, without getting too much in the
Mhm.
weeds. But why, what I really want to impress on people is how big changes like this mean you've got to be alert and take note of what these changes are, particularly depending on your individual situation, and why being in somebody's database as a client with Dave is just like us. You know their situation, you know the changes that are taking place on the big picture, and then can customize and tailor that to theirs.
Yeah, so as I mentioned, these insurance companies are shifting their focus from growth to profitability, and they have literally on some of these advantage plans, they're eliminating entire plans altogether. All right. Now, as agents, we know what those plans are that are going to be eliminated. And if you're a client of mine or if you're in my database, you will definitely hear from me as far as we need to move pretty quickly as far as finding you a new plan. But they're also obviously these insurance companies are going to advise their current members. So yeah, while you may be getting a lot of marketing and messaging, pay attention to the information in the mail that you get from your specific carrier. So if you're with a specific carrier and you get a letter, pay attention to that letter, right? You can disregard anything that you don't sign, that you're not signed up with, or that you didn't initiate. But if something comes from your specific carrier, pay attention to that. And they're required by law to send out those letters every year. It's called an annual notice of change. And by now, most people should have received those letters. So just pay attention to that. But yeah, if you're a client of mine and I see some of them on the call here today, you will definitely hear from me as far as these are the changes that are happening to your specific plan. We've already got your updated information. When the time is right, we'll do a review and we'll reach back out to you with our recommendations. So it's
Yeah, if you're on
especially
this call today or you're seeing this webinar, what I want you to know is this is designed to be big picture, high level.
right.
What we're specifically referencing is how the financial advisory role that we represent as Trinity Wealth Advisors with a specialist like Dave Adams that goes into the nuances. And the particular question is 2026. You've probably all received this in the mail, this little book with let's see, 131 pages, including it looks like a little Chinese. I don't know why our government needs to send us, oh my gosh, there's all kinds of foreign languages in here. But if you need to go to sleep, this is not for that. This is important. My wife, Dave, saw me walk out of the house with this and she said, honey, I need to go over that. And I said, well, good news is, no, you don't. We're going to be talking to Dave later. I think we're set up with you. Is it next week or the following week?
Yeah,
But it's like, honey, you don't need to go through this. And I was like, were you really thinking you were going to go through
right.
it? But talk about how important this is. Well, and then I'll come back from the wealth advisory side.
Yeah, I mean, obviously, every year we have this open enrollment period, and it's a very important time of the year, right? I don't want to belittle what the government sends out, that booklet that they send
You
out,
got one time to make these changes.
right? And what the way we work our business, the way I work on my business is we reach out to all of our current clients and just check in to see if there's been any changes in your health. Are you are there any changes to your doctors? Are there any changes to your prescriptions? Is there any, a question I love to ask my clients is there anything you wish your plan provided in terms of benefits that it currently does not provide? And just let them think about that and answer that question.
Be
Um,
thinking about that, folks, because this is the critical tie-in. Since we're all different, and since we all have different health
mhm.
issues, and Dave, how much have you been through getting ready for this October 1st? How much time is involved with you going through all the changes that happen from the different carriers and keeping up with all that?
Yeah, it's a lot, and it's been a lot more involved this year, knowing what's coming. Yeah, so I attend meetings with every one of these carriers where they present their plans and their changes for the coming year. So we have to go through them.
Makes me feel better already.
Yeah,
You're attending all those meetings. You're
right.
doing
Right.
that. How many of them is it now for Missouri? How many plans are you looking at?
There's seven, I'll say eight main insurance companies that offer, and they all offer multiple plans, right? So just say eight times, there's probably 40 or 50 plan options available. Yeah, so we attend those carrier meetings, we get the plan changes, and that's the other part of the review process, right? We reach out to see if there's been any changes with you specifically, but then we also know what changes are going to be happening with these plans. And when we marry those two together, that's when we do a comprehensive review, like you would do a comprehensive review with your clients every year, and then make recommendations. Hey, in the old days, I say the old days, just not even 2 years ago, it was, I would say 75 to 80% of our clients would just stay on the same plan. It would just automatically renew. I have a feeling that percentage is going to be a lot less this year just because of all the changes we've already talked about. But that's what this period of time is all about. I always equate it to an accountant going through tax season. This is our tax season, right? To be very specific, Medicare's open enrollment period starts on October 15th. That's when you can actually make changes for next year, and it runs through December 7th. So it's roughly a 7-week period, not counting the holiday in there, but it's very busy time for us. But that's what we do, and that's what we're here for, and that's why you work with an independent agent so they can help you figure all that out themselves.
Yeah, I like your analogy of the eight different companies with 50 different options each. In our world of investments, we like to say today there are more expert money managers than there are stocks and bonds to buy. So, how does
Yeah.
someone keep up with all of this? Well, you turn to somebody that knows your situation first. And
Hmm.
again, that's what we like about you, Dave, is once you're a client of Dave's, then you end up having a resource that you can go back to and say, Dave, help me out. What is it? Do I
Right.
just stick with Blue Cross Blue Shield? I mean, that was one that, was the constant forever. And now it's like, no, not quite the same. And life changes. The only constant is change.
So, yeah, I'd like to take just a minute and talk about the importance of working with your financial planner and Medicare. What part does Medicare play in retirement planning and financial planning? And it's obviously a very important part. And while we all have our specialties, I specialize in Medicare, and that's quite honestly, that's all I do is Medicare. I don't do any life insurance. I don't do any annuities. I don't do any financial planning. I leave that to people like Jim. But there is a crossover there, and it's very important to work hand in hand with your financial planner when you're looking at Medicare because there's certain premiums and costs that the way you earn income in retirement can affect your premiums with regards to Medicare. It's called income related medic monthly adjustment amount. So again, I'm not going to get into the weeds in this, but there's a basic premium for Medicare Part B. Everybody pays that premium. But then if your income is above certain levels, you could potentially pay a higher premium based on your income level. However, if you're able to work with your financial advisor and be strategic in how you create your income in retirement, you could get that premium lower back down to that baseline number. So
Thank you for mentioning that, Dave.
yeah.
I know we go through that every October with some of our clients where we're looking at their tax picture before the end of the
Hmm.
year and looking at those maximum marginal brackets and seeing if we can take advantage of some of the lower brackets. Oh no, there's nothing we can do. So some of you, we know that there isn't anything that you can do, but
Right.
many of you, particularly when you've had a changing income year, there are
Mhm.
many ways to take advantage of that. And keep going, Dave.
Yeah, no, it's just an important part of your overall financial plan when you get to retirement. Yeah, obviously healthcare is going to be a part of that, but how you draw that income so that you may or may not be able to your point, adjust your income to bring it down to a certain level to where you don't have to pay that higher premium increase with regards to Medicare. And one other very, very important point I'll make with regards to healthcare in retirement is that Medicare does not cover long-term care. That's a totally separate animal. It's not covered by Medicare. And that's kind of a myth about Medicare. Some people think that, oh, I got Medicare, everything is covered. Unfortunately, that's not true. So you need to make sure you work with your financial advisor to make sure you have a plan to cover that cost, because that can get very, very expensive if you don't have a plan in place.
Good point. For those of you that heard the webinar that I did with Mike Potower or want to get that, this is the one that we did on long-term care.
Right.
And his recommendation is the most important page in this whole book is page 56 that starts with saying Medicare and most health insurance, including Medicare Supplement Insurance, Medigap, don't pay for non-medical long-term care services, including care in a nursing home or in the community. So that's a very important integration for what if something happens there? How do I go through that? And none of us like the cost of healthcare, but boy, that's the fastest growing segment of explosion. Talk about inflation that is affecting people, the cost of long-term care, and that it should be a part of anyone's financial picture or perspective. You're either going to pay for it with assets if you need it, or you're
Mhm.
going to pay for it with some kind of provision, and that is not a Medicare option. But I digress and I divert to another webinar. If you're interested in that, raise your hand or send me a chat or send an email when you get this saying, oh, I'd like to get a copy of that one. That's probably one of the most requested ones that we get. Keep
Right.
going, Dave. 2026, some of the changes that we're headed to.
Yeah, trying to think. Yeah, we can't talk plan specific, and I wouldn't do that anyway. But I guess my point is the biggest takeaway today is if you're already on Medicare, this particular open enrollment period is going to be important for you to reach out to your agent, or if you don't have an agent, obviously happy to help you out as well, and just do a review. The other question I like to ask people is when was the last time you reviewed your Medicare plan? Some people
And
maybe
Dave,
have
how
been
much does that cost?
zero,
Zero. Oh, I like to hear that. Say that again, Dave.
zero,
Zero.
zero.
Okay. My
Yes,
favorite
yes.
answer. But
Yes. And I've done this multiple times. People will get referred to me that are already on Medicare. We'll do a review with them. Again, it doesn't cost you anything. And we'll come back and say, you know what, the plan you're on is the right plan for you. Just stay on that plan. Happy to go through the review, happy to do that. If you ever have any questions, I want to be that resource, whether I'm your specific agent for that plan or not. I at least want to be that resource because I believe that ultimately comes back in multiples as far as being able to help other people out.
Great,
I just
great.
think the
And let
biggest
me
point,
remind our attendees, if you would like, if you have a question, go ahead and throw it in the chat box. Someone told me a little earlier that it was disabled. I think we've gotten that fixed, but feel free to send a question if you have something specific that we'll put in front of Dave. Keep going, Dave.
yeah, no, I don't want to overstate this, but I mean, this is an important review period this year, especially with the changes and the potential that your plan may or may not even be available next year. Again, you should have
Didn't you
already,
say more change than you've seen in recent memory?
yes, yes,
So
definitely.
if this is something that affects all of us past that point of 65, and if you're coming there, if you're 64, know that there's an important resource available here that'll cost you nothing and is someone that you can trust and feel good about with not trying to sell you something and give you good information based on your situation. Dave,
And
how many people do you work with? How does your life change from October 1st to December 7th?
so I currently have just under 500 clients. And while that may seem like a lot, we've been preemptively preparing for this open enrollment period. So I've actively reached out to all my clients starting about 6 weeks ago to get updated information from them specifically. And like I said, we have their information in our computer, in our database. We know what the plan changes are. And as soon as we can start bringing those two together, we will be doing these reviews very quickly. And I have an assistant that helps me out with that. So it's not, it's not it's not an unreasonable number. Don't think that if I can't help you because I got that many people. I can definitely use more business and look forward to helping more people for sure. So,
One of the reasons we loved your business approach to this, Dave, was that you're just like us, proactive.
right.
We're looking at your tax picture before you get to the end of the year. You're looking at people's Medicare
Right.
situation and what the possible solutions are before you get to that date so you can line up. How many of them normally versus this year, if you have a perspective
Mhm.
for that, Dave, are keep it the same versus need change?
Yeah. So again,
Percentage wise, you got any rough?
in the past, it would be about 75 to 80% would just stay on their same plan and renew. We
Keep
would
the
do the
same?
review. It just made sense just to stay on that plan. And quite honestly, that's the easiest, right? We don't have to apply or do anything else like that. My sense is this year that's going to be a substantially lower number that would renew. Probably 50 to 75% of our clients will be making a change based on their specific
Wow.
their specifics. So I'd
So
say probably
complete.
50%, 50-50. So that's what
Yeah, do
this,
not fall asleep at the switch here, folks. I know this season in the year is very tough from Halloween going into Thanksgiving, going into Christmas and New Year's. It tends to be a very busy time for us. And
right,
this is one where it's going to change. I believe you're right. 50% of us are going to need to have some kind of change. And
right,
talk about, I want to alert people to this. We call it stewardship of
right,
just your resources. Don't be shocked. Know that these changes are taking place. This administration has shifted to a lot of deregulation, and as a result, there's going to be a lot of cost shifting. Insurance companies are profit centers. They need to make money one way or another, unfortunately. And at this point in the game, a lot of the cutbacks in beforehand, what used to be a lot of supplementation now is going to be passed on to the consumer.
right,
And that's what's creating a lot of these changes.
right. Yeah, there's just disruption in the market is probably a great way of saying it. And again, while the intended concept or the reason they're making these changes is always to be in the best interest of the members, the people that are on the plans. ultimately the unintended consequence is usually it's higher costs, reduced benefits, potential losing your plan, that type of thing. So it just makes sense to review your plan, talk to an advisor, talk to an agent, and make sure you're getting the Medicare plan that you deserve, because everybody deserves to have this type of insurance, and it's an important piece to your health care. And you just want to have that peace of mind, right? You want to be able to know that going into 2026, I've done the review, I've worked with an agent, we've looked at everything, and we feel very confident and comfortable with the plan we've chosen.
Okay, here's one. Oh, it's saying the chat box is disabled. I'm responding with the Q&A box. So thank you for letting us know if you do have a question for us. Apparently our chat box is down. The Q&A, if someone can fix that for me, great. But the Q&A you can go through, and I appreciate that. Dave, one of the things I wanted you to briefly touch on was the Inflation Reduction Act of 2022 just kicked in this year. And did that surprise people? Were your clients all ready for that because you already knew that was coming into play?
Yeah, we were definitely preparing people for that last year going into this year as far as the open enrollment period. And again, basically what that did, again, the idea behind the Inflation Reduction Act was to reduce people's expenses on prescription drugs. That portion of the Medicare portion of the Inflation Reduction Act was solely focused on lowering prescription drug costs for people that are on prescription drugs. And in a sense, it did that in theory, right? It capped everybody now is capped at a $2,000 maximum out of pocket for prescription drugs. However, it shifted that cost from Medicare itself back onto the insurance carriers. And so this year you've seen it this year, you're going to see it again going into next year. Increased premiums, higher deductibles, shrinking formularies. So a formulary is the whole suite or whole list of drugs that a specific plan covers. And you're seeing some plans reduce those formularies or those drugs that they're going to cover because they're not profitable, right? They're not the profitable drugs that are out there. So you're seeing a lot of that. And some of the co-pays are definitely going up where, for example, you used to pay, maybe you paid $47 a month for a tier 3 drug. A tier 3 drug is kind of a mid-level drug. Well, now that might be a percentage of the retail cost, and it might be 50% of the retail cost. So if that's a $200 drug, now you're paying $100 for that drug, where last year you were paying $47 for that drug. So it's those kind of costs that people might not even realize until they go to get their prescriptions refilled in January, and they're like, well, wait a minute, last year I paid this, now I got to pay this, that type of thing. So that's the unintended consequence of everybody's capped at $2,000, but more people are going to be paying $2,000 than they were before, if that's probably a simple way to say that.
Yeah, yeah. Here's a question from Carol that says, how much, what is this big surprise cost that you get based on how much income you make that you think there's a zero cost with this great advantage plan, and then, oh, it's not a zero cost because of the income that's being made? And how do you plan that with one spouse that's still working, one that's not?
Yeah, sorry, I'm looking at my chart here. So there's basically a chart that says, so that the increase in premium
You want to pull
is,
that up for us to look at, or is
I
that
can,
important?
yeah, I can share
Okay.
that. Hang on a second here. Uh, yeah, here we go, share.
If it's important, if it's a bunch of
Yeah,
numbers and too
no,
deep.
I got it. Can you see that now?
Yes,
Can you see it okay, or I can make it bigger here?
I'll make it a little bigger but there we go. That's wonderful.
Let me do this.
This is exactly what I think that question was aimed at.
Yeah. So very high level again. So this 185 number you see right here, Let me see if I can do this here. Play with one of these tools.
Irma, our good friend
Yeah.
Irma.
So $185, that's the baseline premium that everybody pays for Medicare Part B. Okay, and Part B again is your doctor and your health insurance. If you see over here, if you file your taxes individual, if you make $106,000 or less, then you just pay the 185. If you file your taxes joint, 212,000 or less, you just pay the 185. Where you people run into surprises is if they don't realize that and their income is above 212. I'm just going to focus on the joint. If your income's above 212, between 212 and 266, you're going to pay an additional $74 a month Part B premium, so a total of 259. And then they're also going to hit you with an additional premium for the Medicare Part D. Anytime you see Part D, that's your prescription drug. So you're going to pay roughly $90 more a month because of your income is above a certain level. And you can see it just keeps going up, up. So if you're at the max, if you're over $750,000 of income, you're going to pay $628 for Medicare and another $85 for the Part B. So almost 700, a little over $700 a month in premium. So that's
So a
important.
very major point here, Carol, I know asked this question. How do you know that? When we look at your picture in October, we're looking at your tax picture. We're
Right.
looking at, oh, is there any way that we can keep income closer or reducing? We can do that by shifting IRAs, taking
Right.
advantage of lower income. There's all kinds of ways that can be looked at that. If you're a client of ours, we're automatically doing it. Or ask a question about this. A very important thing that can save you money every month.
Yeah. Yeah. And as you can see, that's a pretty big jump from 185 to 628. And here's another point I'll make about this, because when you're going on the Medicare and you're turning 65 in the year 2025, this income level that they're looking at is actually from 2 years prior, meaning they're looking at your tax return from 2023. Okay, so they're going back 2 years
Oh, yeah.
because that's the most recent data that they're going to have in terms of if you're going to Medicare in January of 2025, you haven't even filed your 2024 taxes yet. So they're going back 2 years. So here's an important point. If you retire and say you're going to retire in June of 2025, such that now your income for the remainder of this year is going to be substantially less than it was 2 years ago. You know, let's say you were at this 334 number and now you're going to be down to this less than 212. If you have a life-changing event such that your income is going to be less than the amount that they determine your premium should be, you can appeal that. There's a simple form. I say simple. There's a form to fill out. I usually recommend having your accountant fill it out with you. But basically, the point is you can appeal this premium decision based on the fact that your income this year is going to be substantially less than it was 2 years ago, and they will then adjust your premium back to where it should be. So
And
that's
you help people with that by giving them a form, something that they can use
there's
with
a
their
government,
accountant.
yeah, there's a government form that you can fill out. Again, I usually recommend having your tax preparer help you
CPA
fill
do it.
that. Yep, yep, because it's a little confusing there, but they've done it before. So yeah, we can certainly
Dave,
provide you with that form, and then that's a way to get that income, or that premium, I should say, back in line with your current income. So,
here's another question that came up. Most of my drugs are cheaper through Good RX.
mhm.
We've all seen that.
Yep.
But you don't get the application for your cap. Talk about, is that a good idea? Is that something you recommend?
Yeah, I mean, anytime you can save money on prescription drugs, it's a good idea, and GoodRx is certainly an option out there. And we will do a little bit of research if somebody's on a specific drug that's very expensive, even on a Medicare covered plan. Oftentimes we'll plug that into GoodRx and just see if there's a savings there. And
Any others
obviously,
that you recommend besides Good RX?
There's a couple of them out there. GoodRx is the one everybody knows, and it works. It's probably the most popular one, so it works the best as far as covering different prescriptions. Yeah, so it would potentially could lower your copay for your prescription drug, but you just mentioned this, that by going through GoodRx, you're circumventing your insurance plan, so that's not going to count towards that $2,000 max. But again, if you're
Yep.
saving money, you're saving money, and that's the most important thing.
Any other questions, folks? We're coming up to the top of the hour. We've got Dave for a few more minutes. Let me open up how to reach Dave. How do people reach you?
Yeah, I should have had that set up here. It's pretty simple. My phone number is 314-270-1771.
And if you're wanting to reach us for any of that coordination,
Yeah.
collaboration, anything on that side, it's 314-966-0033, Trinity Wealth Advisors. And everyone that's on this will be getting a copy of it. So that'll be sent out in about 48 hours. And you'll get a copy of this with it written in. It's a lot of details here, a lot of changes coming. The bottom line is give one of us a call if you've got questions about this. We're happy to answer. Both of us come from the relational side of the business, wanting to help people. And we find out the more we help others, the more the good Lord takes care of us. So, any event, look forward to talking to you then. Any last closing remarks, Dave?
Again, thank you for the opportunity to present this. This is a timely topic with the open enrollment period. And yeah, I'm happy. Just remember, working with any agent, not just myself, there's no cost to you, right? And if an agent does charge you a fee, that's not right. They shouldn't be doing it. And I've never heard of that. So yeah, reach out to an agent, whether that's myself or some other agent, and we're happy to help you. This is a very, very important enrollment period. I can't stress that enough with all the changes coming up. And you don't want to be stuck in a plan that's not going to help you next year. So again,
And
thank you,
I
Jim.
would, you welcome and thank you for helping to clarify something that's fixing to change more people this year, change for more people this year. And I don't think most people know about it. When I talk to people, they're not even aware of how this is going to be because they say, oh, they just takes care of, or what we like about Dave is independent and objective. That's what people like about us. We're independent, objective. Trinity doesn't sell a money management approach. We hire and fire money managers, often having 2 or 3 different types. So we're not your typical money man who is investing it and saving you money by doing it ourselves and obviously telling you how great we are. We hire and fire people depending on how they're doing. And this is a crazy season, unprecedented markets, just like the Medicare situation. One other point I'll make is that Medicare does not cover long-term care. Dave made that point. Thank you, Dave. It just is an important consideration, probably the fastest growing expense that hits people. And talk about an ugly surprise when you're looking at the need for long-term care with a spouse. We've got several clients with a spouse going through this right now, and it's just a difficult thing to exchange. If you're prepared for it, you're always better off. Thanks again for joining us. Dave, your number 314-270-1771 and Jim Matush, Trinity Wealth Advisors 314-966-0033. Thank you for joining us. And if you have a friend or someone that would like to hear this, we're happy to send it out to you or them. Just let us know. Look forward to next month.
Thank
Talk to
you.
you then.
Take care.
Bye.